Dementia is a crippling condition that affects millions of people worldwide, including a sizable number in India. While there is no cure for dementia at the moment, there are medications and treatments available to help manage its symptoms and improve the quality of life for people living with the condition. We will look at the most common medications used in dementia treatment in India in this medications for Alzheimer's disease. Alzheimer's disease is the most common type of dementia, and the medications used in dementia treatment in India are primarily aimed at managing its symptoms. These medications are classified into two types: acetylcholinesterase inhibitors and memantine. Acetylcholinesterase inhibitors. These medications work by preventing the breakdown of acetylcholine, a substance found in the brain that allows nerve cells to communicate with one another. Acetylcholinesterase inhibitors that are commonly prescribed in India include donepezil, Aricept. This medication is used to treat mild to moderate Alzheimer's disease as well as more severe cases. Rivastigmine, Exelon. This medication is effective for mild to moderate Alzheimer's disease and may be preferred if hallucinations are a frequent symptom. Galantamine, Reminol. A medication used to treat mild to moderate Alzheimer's disease. These drugs have shown promise in the treatment of dementia with Lewy bodies, Parkinson's disease dementia, and mixed dementia, Alzheimer's disease combined with vascular dementia. Common side effects include nausea and loss of appetite, which usually subside after a few weeks of treatment. Memantine. Memantine, also known as Namenda, is a medication prescribed for people who have moderate to severe Alzheimer's disease, dementia with Lewy bodies, or a combination of Alzheimer's disease and vascular dementia. It works by preventing the effects of an excess of a brain chemical known as glutamate. Memantine's most common side effects are headaches, dizziness, and constipation, all of which are usually temporary. Medications used to treat related conditions include stroke, heart problems, diabetes, high blood pressure, high cholesterol, chronic kidney disease, and depression can all have an impact on dementia symptoms, particularly vascular dementia. To effectively manage dementia, it is critical to diagnose and treat these conditions. Medications for challenging behavior include: some individuals may experience behavioral and psychological symptoms of dementia, BPSD, in the later stages of dementia, which can include increased agitation, anxiety, wandering, aggression, delusions, and hallucinations. Coping strategies are usually the first line of defense against these symptoms. If coping strategies fail, antipsychotic medications such as risperidone or haloperidol may be prescribed for persistent aggression or severe distress. In cases of moderate to severe Alzheimer's disease, risperidone and haloperidol, and vascular dementia, haloperidol, the only licensed medications are used to reduce the risk of harm to the individual or others. Risperidone has some serious side effects, so it's important to use it as little as possible for as little time as possible. Haloperidol is sometimes used when nothing else has worked. The decision to prescribe these drugs should be made by a consulting psychiatrist. Alternative therapies and non-pharmaceutical treatments. Some people with dementia and their carers may look into complementary treatments like ginkgo biloba, curcumin, or coconut oil. However, there is insufficient evidence to support the efficacy of these remedies. Before considering such products, it is best to consult with a doctor because they may interact with prescribed medications and should never be used as a substitute. Only one aspect of dementia care is medication. Non-medication treatments, activities, and support are all important in assisting people with dementia to live well. Among these non-medication treatments are cognitive stimulation therapy, CST, a series of group activities and exercises aimed at improving memory, problem-solving abilities, and language ability. Cognitive rehabilitation. Working with a trained professional to achieve personal goals and improve daily functioning is referred to as cognitive rehabilitation. Reminiscence and life story work. Using props, photos, and keepsakes to improve mood and focus on individual skills and achievements, participants engage in discussions and compile personal histories.